So we're not sure of the long-term effect of Ozempic or Wegovy, mainly because they're relatively new medications. However, the risks of having an injection once a day compared to having surgery are very much less with Ozempic. It is only an injection once a day. The GLP agonists like Ozempic and Wegovy have two side effects. They definitely make you feel a bit nauseated when you take them because it slows gastric emptying and can make you vomit. It can bring some of the food back up. Virtually all patients on Ozempic or Wegovy say that they have constipation. The second issue with the GLP agonists is the increased risk of pancreatitis. So if patients have had pancreatitis in the past, they cannot be prescribed weight loss medication. It's a contraindication. From the point of view of surgery, bariatric surgery has got safer and safer over the years, but it's still an invasive surgery. It's done with keyhole surgery, so there's 4 little cuts the size of my fingertips, 1 or 2 nights in hospital, and a week off work. The biggest risk with the surgery is the leak from the staple line. So when we do traditional surgery such as a sleeve, gastric bypass or a SADS, we're actually stapling the stomach and the intestines and removing part of the stomach. If those staple lines don't heal properly, it's possible for gastric juices to leak out, and that can give patients peritonitis and make them really sick. Fortunately, over the last few years, the risk of a leak is about 0.1%, so less than 1 in 1,000 patients have a leak from bariatric surgery these days. And it's the better instruments and equipment that we have now. We actually have a tri-stapler to staple the stomach, which fires 6 rows of staples. So even if 1 or 2 of the staples don't heal properly, there's a 3rd, 4th, 5th and 6th row to try and prevent that. We use Seam Guard, which is a reinforcement material made by the Gore company, so it's like Gore-Tex that they put on coats. That decreases the risk of a leak. And then we use a glue over the top of the staple lines called Tissio, and that Tissio decreases the risk of a bleed from the staple line. So over the last 10 years or so, bariatric surgery has become much more safer due to the advancements of techniques and instruments. But I have to say, the risk profile of taking medications is way lower than the risk profile of a surgery.